Good afternoon, everybody. Here with Josh and Paul and Jim Rivers, the town manager from Wyndham. I'll explain why in a few minutes. First, let me cut right to the chase. These are the COVID daily numbers, and I look hard to find a silver lining, and I can't find it in these numbers, except perhaps the fact that we have done a lot of testing. Over 150,000. But what you ought to see is with 1,300 new positive tests, that's a 6.1% positivity rate. That's the highest rate we've had since June 1st. Couple that with hospitalizations continuing to creep up and fatalities. There's no good news in those numbers. And it reflects what's going on in our region. Despite the best efforts of the people of Connecticut, we are part of a region, and it reflects what's going on in the country, where they've had the highest infection rates so far throughout. And that 6.1%, I usually can say, oh, don't worry, it's just a one-day number. Our 7-day rolling average is 3.1%, but let's face it. We've gone from 1 to 2 to 3, and this 6.1 may be a harbinger of things to come. And it's going to get worse before it gets better, but we're going to weather it together. Let me tell you what it looks like on your map. I said we're going to show you the COVID alert map on a weekly basis to give you an idea of what additional towns are in the red alert status, which we can conceive of as 15 new daily infections out of 100,000. And by the way, that does not include correctional facilities or nursing homes. These are things that are more indicative of community spread. And we've gone from 19 to 30 towns in that red alert status. Again, primarily there in southeast Connecticut, if you can see in that map. And another 53 are in the orange category, which are, as we found out over the last week, often are moving towards red. So between the red, which represents about a third of our population, and the orange, which represents a little over a third of our population, I think you get an idea of what the trend lines are. I'll tell you what that means in a second. Let's take a look at the next chart. So what can we do? If you're in the red alert area, we have said you have the option of rolling back to phase 2. And so far, there's been one of these towns has elected to take that option, and that's Wyndham. And one of the many reasons that, we've got Jim Rivers here with us. We're going to allow anybody in the orange or the red towns to exercise the discretion to roll back to phase 2. I think in terms of erring on the side of caution, allowing municipalities to do the right thing, just like what Wyndham has done, I think is important. Just as a reminder, we only moved to phase 3 less than a month ago. So if you roll back to phase 2, what does that mean? That means not 75%, but 50% occupancy in your bars, not your bars, but in your restaurants or personal service, nail salons, barbers, hair, and the such. That would mean no more indoor performing centers. We had a partial opening there. A maximum of 25 people in gathering. We had upped that in phase 3, but that's what phase 2 would mean. These are all things which you can do as municipalities on your own. It sends a signal that we're taking this seriously, and we know that the COVID infection is ramping up, and it's ramping up not just by municipality, but in terms of southeast Connecticut, some other regions, and you can be proactive there. And over the next few days, we'll see whether that's enough. We're also giving you flexibility in thinking about what we do with winter sports, to be blunt. You probably have heard me say that Massachusetts has closed hockey rinks or paused hockey rinks for 2 weeks. New Hampshire has done the same thing. They've done that because hockey or all the activities in and around hockey have created a lot of infections, well over 200 in Boston alone. We have about 45 hockey-related infections, and in part that's the first of the winter sports that's getting going. I'm not positive it's exclusive to hockey. Again, Paul and myself, I reached out to all of the governors in the region as we try and think about what we want to do together, in terms of phase 2 and restaurants, what we want to do together in terms of sports and winter sports. And my guidance to you would be, be careful this weekend. Let's see if we can do this right. Obviously, some of the rinks have been very strict in their enforcement. Some have been more casual. Some of the restaurants have been very strict. The overwhelming majority of our restaurants have been very strict. Some have been casual. So we'll see whether enforcement is enough or whether we're going to have to be stricter, and we'll figure that out early next week, and in many cases working in collaboration with our regional states. I think you know what we've already done on nursing homes, but given what happened in our nursing homes back during the first wave of COVID, we are testing all staff on a weekly basis, any residents on a more regular basis. If any cases, they'll be tested at least weekly. If there are any cases, they're not allowing visitation. If there are no cases there, you could visit. I would strongly recommend that you be tested before you go visit a loved one in a nursing home. Again, in terms of other actions to slow the spread at this point, we're increasing the focus and targeting on high-risk activities and enforcement. We have talked before about some of the bars masquerading as restaurants, and I got to say, you've been pretty strict. Our municipalities, working with the departments of public health, they've shut down a number of these facilities. They can fine you $100 for not wearing a mask. They can fine you $250 for going to an unsanctioned party, the likes of which you maybe saw on our Twitter feed the other day, or fine you even more for organizing an event like that. I'm going to see what we can do a little bit longer by strict enforcement, allowing you that enforcement, giving you the tools we need to keep your communities safe. And by the same token, consumer protection here at the state level, we're going to be looking at liquor licenses and see what flexibility we have there to, again, show that we're serious about enforcement. I'm doing everything I can to keep our economy going. I'm doing everything I can to allow us to have some level of normalcy. And I'm trying my best to do this with enforcement and self-regulation, what you can do in terms of your sports, what you can do as municipalities, what you can do to roll back like they've done in Wyndham. And if that's not good enough and we find we've got a stretch going on next week, we'll take a look at putting in another level of strictness. Just tell you on the next chart, might as well tell you, as I look around the country, and more importantly, or just as importantly, as I look around the world, and I've described this before, what are other places doing? We described a week or so ago what we see in Europe. Europe is, say, 3 or 4 weeks ahead of us. They've been the canary in the coal mine. They are beginning to roll back. They are, closing down pubs and cafes and restaurants, or at least closing them down at a certain hour, say 6 o'clock in the evening. They're being stricter in terms of stay safe, stay at home orders, if you remember that from some 6 months ago. And while they're being very strict there, they are continuing to keep their schools open. So I thought that was interesting. They're finding the same thing as we are, that in-classroom activity is a low infection area, at least to date. As I see here, we now have a dashboard we're putting up. You can see at the bottom in that really thin light blue, go to the data.ct.gov COVID school. You can look up your school. You can see exactly what the infection protocols are there. Just very quickly, in the last week, we had another 123 staff cases. That's up 18 from a week before. That's out of, tens of thousands of staff. Student cases, a total of 233 new cases reported. That's an increase of 3, so relatively flat compared to what you're seeing in the general population, certainly. In person, which is interesting, 76 infections related to what was transmitted in the school. That's down 5. So, and that's 76 compared to, say, 400,000 or 500,000 kids who are going to school in person, or at least have the option of going to school in person. Hybrid, about the same as last week. And fully remote, which is interesting, many fewer kids going fully remote. Maybe it's 5-6% are fully remote in terms of schools that aren't open at all, but more not or telecommuting or distance learning. And there you're more likely to have, some infections. I thought that was just an interesting slide, just in terms of as we think about sports, we think about restaurants, and we think about schools, where is the spread and what can we do about it on a voluntary basis, on a municipal basis, or even on a statewide basis and a regional basis. With that, look, I'm putting a lot of responsibility on the shoulders of our first selectmen and mayors and town managers. And Windham is a town that was in red alert status. Windham is a town that decided, is about the only town so far that has decided to roll back from Phase 3 to Phase 2. I think you're going to hear Stamford and New Haven elect to do the same thing over the next day or two. And I got to tell you, don't think it's because Willimantic's not a fun town. It's, in my experience, it's the funnest town in the state of Connecticut. If you ever been to Willie Brew, if you ever remember the Boombox Parade. But that said, they also know how to take COVID seriously. And Jim Rivers, I'm just going to ask to talk for 2 minutes about what drove him to make this decision, what he sees in terms of track and trace, perhaps what our other towns can learn from the Windham example. Jim?
Thank you, Governor. It's a pleasure to be here, and thank you for your leadership in providing us with the tools we need to get through this. We made a decision when you offered or put 9G out, order 9G out, that we needed to take advantage of that. We've been tracking our numbers since day one when this began in March, and we've been very vigilant here in Windham, like many other communities in Connecticut, taking this very seriously. And we saw the numbers climbing from early September on. That's the time when we were very attentive, because the two universities, we serve UConn and Eastern Connecticut State University with a lot of off-campus housing here in Windham. And we saw, the cases start to climb, and we needed to take action. We've taken a lot of local action, the restrictions that we could take within our hands, but having the opportunity to go back to Phase 2 made a lot of sense to us with the data that we were viewing, and we're letting data drive the decisions, which I've really shared with the community from day one, that we're going to let data decide. And as our numbers went up, we increased the restrictions, and as things get better, we may loosen those restrictions. But we are coming into the winter, and that's another thing that we really considered. Interestingly, you mentioned the schools. As we started to trace the infections as they spread across Windham, we have a public school system that opened on a hybrid basis from early September, and the Eastern Connecticut State University, our partners there, Dr. Nunez is a great leader of that school, and we found that most of the infections were not coming from and derived from schools, that it was coming more from families and friends and groups outside of, I'll say, a controlled environment where there are protocols in place. So that's something I think that people are starting to see the data come through. Everyone needs to help pay attention here, and that's what we're trying to. It's a message going from Phase 3 to Phase 2. It's also a message that we need to do something, and everybody needs to do something individually. And we thank you again for your partnership in allowing us to do this. I hope that we get through this together. But winter is coming, and that's another thing that we recognize. The cold weather is coming, and we wanted to get our baseline down as low as we could in Windham, and make sure that we don't have that exponential growth from, at least if we do, we will have it from a lower baseline.
Hey, well said, Jim. Jim is sticking around to answer any questions, as are Josh and Paul. Over to you, Max.
NBC Connecticut.
Good afternoon, Governor. Are we seeing a second wave or not? Is it one wave with multiple peaks? How is the state looking at this right now?
I look at it as the second wave. Dr. Fauci said it's a continuation of the old wave. It never went away. Measles never goes away. That's just, but I think we always knew that in October, November, December, with the colder weather and the flu season, we were going to see a second wave. I was hoping that it was more gradual. Today may be a harbinger that it's steeper than that.
And Governor, when you say that you're figuring out early next week what to do, I just want to get clarification on this. Do you mean specifically the potential of going back statewide to phase 2?
I think I still am focused on the red alert towns, which is, like I said, about a third of the state right now. I think with track and trace and targeting, we're able to manage that. I was just talking to my fellow governors, in New York, for example. They've got 3 or 4 neighborhoods where they've been very strict in terms of those red alert areas and beginning to, maximize, closing down some of the infection there and closing down some of the economy in those particular areas rather than doing it on a statewide basis. But pretty soon we may look like a statewide.
And regarding going back to phase 2, maybe Jim Rivers can touch on this as well. City leaders, town leaders, obviously state leaders have all said over and over that the spread is mainly caused from COVID fatigue and private gatherings. So if that is still the case, how is it that going back to phase 2 helps in any way? I imagine restaurants are saying, look, we're not the cause of it. Why do we have to suffer because of it?
Well, like I said, I think right now, Jim can speak for himself, but I think going back to phase 2 sends a signal that, we're on alert and we're paying attention to this. And whether you're at 75% or 50%, it sends a signal that we're being cautious about this. You may say, why don't you do this for everybody? But the restaurants in those green zones, those areas that have a very low infection rate, we decided they should be allowed to stay open. They've earned the right to stay open. So rather than impose a statewide mandate at this point, we thought that was premature. But Jim, do you want to jump into that?
Sure, Governor. That's a good question. And I think what we need to understand is that infections are still coming from every direction. Just because we're focusing and tracing back to some of these non-school or organization or workplace gatherings as being maybe a place where a lot of the infections are coming from, they're still coming from everywhere. And every bit matters, and that's the way we looked at it here in Windham. That we should work it from every angle, and that's what we do every day here to try to find every way to squeeze this thing back.
And really quickly, in regards to the travel advisory, what do you recommend to Connecticut voters? For example, a voter had emailed us that he was in Massachusetts when it landed on the list, and now has to quarantine for 14 days, which will obviously be past Election Day. And that person had not requested a ballot and fears it's now too late to do so.
That's a pretty complicated question. He needs a ballot in order to vote absentee and can't get back in time for election. We'll find a way to accommodate him in that particular situation. More broadly, I think the answer is we're really urging people to stay closer to home. Yes, you can travel to New York. We're not going to say no to that. You can travel to Rhode Island. We're not saying no to that. But we are urging you to stay close to home. That's the safest place to be for the foreseeable future. If you can telecommute, telecommute.
Thank you.
News 8.
Good afternoon, everyone. Governor, we've talked in the past about what a balancing act all of this is. When you talk about, and Jim mentioned letting the data decide, is there a number in your mind? I mean, 3 and 4 got our attention. Obviously, 6 really gets everyone's attention. Is there a number where we could get to where you would say, you know what, now I'm going to mandate we all go back to phase 2?
I think we're getting close. I've always said I didn't have an absolute number in mind, but I also worried about the pace. And let's face it, if this 6 is for real and not an aberration, it looks like it's part of a trend, this is something we got to take seriously. Obviously, when it comes to phase 2, that's one thing. We're also talking to our fellow governors about sports, restaurants, and everything else if this thing gets above 6%.
Last week and then earlier today, you talked about what's been going on in Europe and then being a few weeks ahead of us. As you pay attention to that, is there something now that you're looking at very closely that you can see maybe us following suit in, or is it still too many moving parts right now?
What have I learned from that European example? I think we've learned that how fast COVID can come back, even in places that had a very, very low infection rate, even in places that, let's say, were a little hit or miss in the United States of America, but in Europe they were pretty strict on testing. They were pretty strict on wearing the mask and the other protocols, and it's still ramped up there as well. And I think I've learned a little bit about what their priorities are in terms of restaurants and cafes and keeping schools open. I thought that was all instructive.
Fox 61.
Hi, everyone. So, Governor Lamont, continuing on this same line of questioning here, you have Toronto FC playing at Rentschler on November 1st, this Sunday. I know that there's social distancing and masks required, but does this kind of an event concern you right now with people coming from possibly all over the state to watch this?
Let me say on a personal basis, you're not seeing me going to a lot of indoor dining, and I don't think I'm going to be going to big events like that. But I thought about it. Do we shut it down and say no? It's I think it's no more than 5,000 people in a stadium that holds 10 times that number. There will be distance and mass. But maybe Paul Mounds, you're my soccer guru.
Well, actually, Josh is your soccer guru. I do the other football. Other than that, as the governor stated, yes, there's going to be social distancing and such involved. I think as the numbers continue to move in the state, we're going to be watching very closely as it deals with all of our various guidelines, particularly under our sector rules. But I know for sure that under CRDA that manages the facility and with the agreements with Toronto FC that they're going to adhere to not only all of the state guidelines, but go above and beyond as well.
Yeah, I think it's also important just to point out it is an outdoor event, and everyone will be wearing masks. And there's very few examples that have been documented of that. The combination of those two things and the social distancing being particularly problematic.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, going back to the red alert towns, we were talking with some New London, for example, who says that it really won't work on a town-by-town or city-by-city basis because of people just traveling. What do you say to those mayors and the majority of the mayors who really aren't rolling back to phase 2 right now?
If it doesn't work on a town-by-town, you're going to find New London is pretty soon surrounded by other red towns, and they should all do the right thing, I think, and scale back. But we came to that same conclusion 6 months ago, and we said even doing it as a state doesn't always make sense. We can drive right across the border to Rhode Island and New York. So I think right now we're going to target on those towns and put in the track and trace and extend the testing and see what we can do to contain the fire and see with strict enforcement whether that can make a difference. And I hope they are tough. I mean, New London, they always had a football tournament there of some sort. They're not going to do that now because the mayor there said it wasn't a safe thing to do. And we can change course next week if we find we have to.
And you mentioned today that you might get tougher on these red alert towns. Can you preview what might be in store for them other than just recommending that they roll back to phase 2?
Yeah, my strong recommendation is roll back and send the message. This fire is accelerating, and I think most of them some will do it. Let's see. I mean, I've heard, 2 of our biggest cities have already stepped forward to do this. But if we find out on Monday that this hockey stick acceleration of the infections is continuing, and most of these towns say, I can't do it on my own. Perhaps I prefer having the governor of the state step in, and we would step in and make sure that all the red alert towns did the safe thing.
And final one from me, Dr. Murphy earlier this week on Monday at this news conference, he was talking about hospital capacity being at a decent, appropriate level. But if this trend continues and goes higher, are we going to be okay hospital-wise?
We are for now, and we're monitoring that carefully. And, somebody asked, what's your trigger point if we have to do something stricter? I look at hospitalizations. Right now we have a lot of capacity, but we're also seeing in other states how fast that can change. So on 2 or 3 weeks' notice, I want to make sure that we have the ability to pivot in case our hospital capacity is at any risk. We're not there yet.
News 12 Connecticut.
Hi, Governor. I just wanted to ask you about the quarantine rules for other states. I know you've been working with New York and New Jersey. Is there any movement on a new nationwide policy for travelers?
I don't think so. I think broadly speaking, just about every state in the country, unless they abut Connecticut, has to quarantine and test before they come here. That's part of our strong suggestion you stay close to home during this holiday season. When it comes to our neighboring states, obviously you can't enforce that. You're driving back and forth. You're not flying. But we still urge you to stay close to home.
And also, you mentioned the added testing at nursing homes. How are the cases in nursing homes looking? I mean, they were contained pretty well for a while. Are we still seeing that, or are you guys seeing an uptick in cases at nursing facilities?
Why don't you take that, Josh?
Yeah, no, there has certainly been an uptick. We have, I think it's as of today's report, I think we have 27 nursing homes out of 213 in the state that have at least one resident case. That is higher than we've been in recent weeks, but as mentioned, still a relatively small percentage of the total. But as the governor mentioned earlier, being proactive and knowing that once COVID gets into nursing homes, how quickly it can spread, we have reinstituted testing for all nursing homes weekly for their staff, even nursing homes that have not had any cases. So the previous guidance had been if you test negative for 14 days, you can go back to monthly testing your staff. We've ratcheted that back up to weekly just in anticipation of more community spread and wanting to make sure that we catch any infections early. So our team at DPH is all over this. They're working with the homes, aggressively continuing to do site visits, continuing to work with them and working to make sure that our seniors in those homes are kept safe.
WTIC 1080 News.
Hi, any updates from your vaccine advisory board? We got the initial draft plan a few weeks ago and we haven't heard. Is there anything significant to update there?
Josh?
And I think nothing significant to update. The teams have been meeting, the subcommittees have been getting organized, continuing to receive some guidance from the federal government. So we'll have more to report in the coming weeks, I'm sure, as that work progresses. And hopefully we get some good news on the national level on the continued progression of the vaccine candidates.
And Josh, how do you feel state workers are doing with all this? They've been on remote non-essential workers for months, and that's a huge operation. So how's that going?
Yeah, thanks for asking. I mean, I think whether it's our state workforce, whether it's the healthcare workers, nursing home workers, first responders, right? There's a lot of people out there across the state that have been working incredibly hard under very stressful circumstances for a long time. And now as we look at these numbers tick up, it's tough. But we've got some of the most dedicated public servants working on this. Our healthcare workers are absolutely unbelievable. And I know the governor and all of us are incredibly proud of the team that we get to work with every day.
The Associated Press.
Thank you. Good afternoon, everyone. Governor, John Hopkins says that Connecticut's 7-day rolling average is 2.58% between the 14th and the 28th. Could this 6.1 be a fluke, or are you guys seeing, it sounds like you're seeing something differently?
Everybody has a different 7-day start and end date, so that those numbers are around. But so it's not a fluke. I mean, I wish I could tell you 6.1 is so much more than anything we've seen, and I'm not alarmist. We're going to come down from that number. It's a one-day number, but I think the trend line is clear. The trend line in our state is clear, in our region is clear, and in our country is clear.
Okay. And today the nursing home and assisted living oversight group met. I guess I hear myself echoing. What do you hope is going to come out of this joint legislative and executive branch group? And are you planning to extend the civil immunity for nursing homes?
My instinct is right now, given all the complexity in and around a second round of COVID, I'd be inclined to extend that immunity, but we haven't really focused on that as much. I think we tried to be really transparent on the nursing homes. So we were hit really hard, a lot of fatalities early on, and that's true of a lot of our other states as well. We commissioned the study, we made that public, shared that with fellow governors so we could all learn from that example what we have to do in terms of testing, what we have to do in terms of cleaning, what we have to do in terms of masks, what we have to do in terms of visitation. And I'd like to think that this joint committee is going to be able to act on that so we're even better prepared next time around.
And do you expect that they'll come up with recommendations for changing the way nursing homes work in the future, changing the way home care works in the future in light of COVID?
Yeah, that's a really good question. I hope they do. I mean, one of the reasons we had a lot of fatalities related to nursing homes, we have many more people per capita in nursing homes than other states. And as you pointed out, home health care is an option, and Medicaid and supported, and it's something we ought to look at when you think about the mix of solutions for our elderly residents.
And I had a quick question for Josh. Josh, is the state still purchasing PPE for the stockpile, and have the prices normalized because they were all over the place in April and May?
Yeah, prices have largely normalized and have for some number of months. And yes, we continue to purchase PPE. Our stockpile is extremely large. We're actually above our 90-day supply in many of the commodity categories. And of course, we continue to use PPE both for our own state operations and where mutual aid is required. So we're staying on top of that. We're obviously looking what's happening around the country, around the world, and making sure that we maintain robust supplies.
Okay, thank you very much, everyone.
The Waterbury Republican American.
Thanks very much. I was wondering, what was the reaction in Windham to businesses, particularly, I guess, restaurants, to the decision to go back to the Phase 2 rules? I was speaking to the governor earlier this morning, and he thought that, and he's also said it at this news conference, that there might be a reluctance among some cities and towns to take that step because of the consequences for businesses in those communities.
Why don't you take that, Jim?
Thank you, Governor. We spoke to folks before and after we made the decision to go back to Phase 2. For the restaurants in particular, I think the protocols more or less overshadowed any, going from 50% to 75% for many of the restaurants. To try to achieve the 75% capacity rule while still maintaining the protocols really kept most restaurants back at 50%. There were some, of course, that could expand. But overall in Windham, I can tell you when you communicate enough and you educate the public enough in advance, when you make a decision like this, they should be prepared for that decision, and the reason why you're making that decision should be known. And I think in Windham, we're strong, we're tough here, and I think people, including businesses that are staring at a freight train here going into winter with no outdoor seating, I think they really, they're hurting and they wish there was another solution, but they do understand we're trying to keep them open entirely, not entirely, but partially. If we don't do something now, we're going to pay the price later and maybe have to shut them down entirely. So I think most of our businesses understand why we did what we did.
And what have been the objections from businesses that disagree with your decision, if any have voiced them to you?
The objections that we did have, I wouldn't call them strong objections, but I would say, hey, we're hurting enough. We're trying to make it here. We're trying to pay the electric bill. We're trying to pay the mortgage. And we need every nickel of revenue coming in the door right now. And I think it's really just a concern, and this is a universal concern for most businesses, the uncertainty of going into the winter. And I think they're just trying to squeeze every nickel they can. And again, most of these folks are very responsible, and they get the balancing act that we're all going through right now as leaders. And we're getting a lot of support, albeit, people are hurting, and that's the bottom line.
And Jim, tell them that we are here to help in this sense. We have a program called Shared Work. I've been a solo champion of this. If you are a restaurant, you're not sure you can afford to keep that person on because they only need them for 50% of the time, our Shared Work federal program will pay the other 50% of their salary. So please make sure this is a program that your restaurants and others that are going from 75 to 50% know we're there to help support them and help keep people employed.
Okay, thank you very much.
Hearst, Connecticut Media.
Thanks very much. Good afternoon. Sticking with the subject of restaurants, Governor, we are noticing a lot of large groups in restaurants, 12, 15, 18 people. I don't want to cast aspersions on age groups, but they tend to be under 30, and they are perfectly legal under either phase 2 or 3, as long as that group is under 25, as you know. 25 or under. Do you have any plans to adjust that? Because that's something that I think other states are not allowing.
Well, Dan, maybe we have to take a look at that. I mean, obviously, if they're sitting down, they're part of a group, they're a family or something like that, we were allowing that. But we're going to look at the size of these gatherings, private and public gatherings, over the course of the next few days. And you've mentioned this to me before, that it might be a problem, and we will do that because I think strict enforcement is the best way we can keep these restaurants open.
Right. Thank you. I have a question about the election now. This is probably all going to put a little bit more fear in people's minds about voting on Tuesday. As you know, we're looking at about 1.1 million people at the polls live. Is there anything related to election security, either voting security or COVID security, coming up that you may have?
Well, I'll start with that and then pass it over to Paul. But thankfully, and with help from the legislature, we have more people voting absentee than ever before. And they can do that safely. They can mail, or now it's too late to mail, but they can drop at any of our hundreds of different lock boxes. So I think that's going to hopefully mitigate some of the consternation there. But Paul, maybe you want to talk a little bit about security as well.
Yeah, I'll add one item and then talk about security. As you know, we have received a record number of absentee ballots here in the state of Connecticut for individuals to vote and utilize their constitutional right to vote. We received correspondence last night from the Secretary of State's office asking to extend the deadline through our executive order guidance to extend the deadline for towns and registrars for their application of pre-processing of absentee ballots. As that deadline came about, many towns realized that they wanted to exercise that right. We've been in contact with the Secretary of State's office, Attorney General, as well as the legislative leaders, and the governor will be moving forward with an executive order today to extend that deadline to allow those towns who were coming in after the deadline to be able to utilize that aspect. And as it deals with security, Commissioner Ravella and his team are working very diligently, and I don't want to provide too much, but I will say that they have put forth a plan working with regional, state, and national partners to ensure that individuals will be able to vote safely in person on Election Day.
So to be clear, you're saying that towns will be able to start opening the outer envelopes Friday, even if they miss the 17-day deadline prior?
For the pre-processing, we will provide an executive order that will allow for those towns that provided a notice after the deadline to be able to provide that notice, and they'll be able to start that pre-processing on Friday.
Got it. And just lastly, I wanted to know for Governor, if you have any comment about the Stratford fiasco. There were 270 apartments in a building, in a complex that were in the wrong district for some 7 years. And now they're finding another street with 10 houses. What's going on? Does the state need to step in over there in Stratford?
Dan, I got to get back to you on that. I can't speak to that. I don't know whether this is a long-standing issue or a near-term issue, but we'll get to the bottom of it and get back to you.
Yeah, I'll jump in, Governor. I was on the phone with the mayor of Stratford, Laura Hoydick, who's taking a leadership role to make sure every individuals who had the wrong absentee ballot received the right one. I know that they are hand delivering those, so we are going to stay in touch, and I know the Secretary of State's office is also doing that as well. But I thank the leadership of Mayor Laura Hoydick on that matter, who is really stepping into it.
Thanks.
Thank you.
The Hartford Current.
Hi. Governor, you said when the numbers first started to tick up that once we got to maybe 3 to 5% positivity rate over a 7-day span, we'd start to talk about rolling back, reopening. By my numbers, we're now at 3.1% over the last 7 days and continuing to go up. So is that threshold still meaningful to you, or what is the threshold we should be looking at?
Yeah, my strong recommendation to each of those towns in the red alert status is Phase 2 is probably a safer place to be. And by the way, it sends a message to people in your community that you're in a red alert status, and be careful. I've been pretty clear about what I think in terms of where we maybe are going to be going with sports. So I urge you again to be very careful about enforcement when it comes to sports. We're trying our best to keep these open, but it's in jeopardy right now.
So as you pointed out, the Phase 2 to Phase 3 jump was not the biggest jump. It was, a little increase in capacity for restaurants, for libraries. So as you look at potentially rolling back, is there any thought to like a more dramatic rollback as opposed to just turning down those capacity numbers a little bit?
No, you're absolutely right about that. And I hope not. I mean, we've been living under this COVID cloud for a long time. We've been following the protocols pretty good as a state, and now we're getting hit. There's no question about it. And I'm trying to find every way I can to help navigate through this. But let's face it, if this infection rate continues to continue on an upward trend, we're going to have to make some changes to make sure you're safe.
And then lastly, when Scott Gottlieb was here last, he talked about allowing K-12 schools to get some in-person time in for the first few weeks or months of the year before potentially having to roll back. I'm wondering if that framework still makes sense to you, that it's almost inevitable that at some point we're going to, send students home, and we're just trying to get them as much in-person education as possible.
Yeah, that's exactly right. Look, our colleges anticipated this fall surge, and they scheduled so that they could close down for Thanksgiving vacation and probably not come back. I've been urging our K through 12 do some in-person learning while you can. I can't promise you that right through November and December we're going to have the same opportunities. Thankfully, majority of our kids have the opportunity for in-person education. And when it comes to the high schools, I think they're more likely to be hybrid. They're more likely to be better at doing distance or virtual learning. But I'm glad that most of them had at least hybrid and some in-person opportunities.
So you think it's likely that eventually more of them are going to be remote?
Right now, look at the trend lines. They're not that good.
Thanks.
The Connecticut Mirror.
Thanks, Max. Governor, I was looking at the map with the new category of towns that you've added, that you're giving the option, the towns in the red now and the towns in the orange. It looks like that's roughly half the state. Do you have the total number of communities that now have the option of rolling back to Phase 2?
Yeah, it's we've gone from 19 to 30 towns, Keith, in the red, and that's about 32% of our population. Add on another 53 towns, which are in the orange. That represents about 38% of our population. So it's about half our towns and what is that, 70% of our population right now have the option of going back to phase 2.
Governor, I just want to make sure, are you recommending that communities only in the red or also those in the orange take advantage of this and roll back?
I strongly recommend it for those in the red, and I'd say for those in the orange, err on the side of caution, yes.
Thank you.
CT News Junkie.
Thanks, Max. Josh, I think I heard you say earlier that we have 27 nursing homes where there's at least one COVID case. I was wondering, how many nursing homes would you say that there are more significant cases where you would consider it to be an outbreak?
And just to clarify, that was 27 with at least one resident case. There's some other homes that have at least one staff case. But as we've seen over the summer and throughout, with proper use of PPE and so forth, oftentimes we'll catch a staff case and there won't be any transmission into the residents. And from an infection control perspective, our team at DPH reminds us that that's kind of a win, right? That's a sign that the PPE is working, the infection control procedures are being followed. Yes, there's about 8 facilities between, I think there's 2 assisted living facilities, another 6 or so nursing homes where there are more significant outbreaks that are being assisted by our team at Department of Public Health, where we're providing additional assistance where there's more than one case and there's some concerning trends.
Okay. On the PPE front, do we have enough N95 masks where we can get back to using single-use N95 masks for frontline workers?
Well, it's a complicated question because the CDC has put out guidance, and the guidance has been evolving around what is appropriate use for different types of PPE and for different types of individuals working in different types of environments. So there's not a simple answer to your question. We do in our stockpile. We do have we've achieved our goal for N95s. We know that the N95s, medical grade N95s, continue to be direct shipped to our hospitals, in particular by the federal government, who continue to play an involved role in the supply chain. It's a complicated question you ask, but suffice it to say we're well supplied at the state level.
So our guidelines at this point aren't single-use N95, right? Is what I think you're saying.
Well, again, it depends. My understanding is it depends on the environment that you're talking about and the role that the individual is playing. And obviously, if the mask is soiled, it has to be disposed of and so forth. So it's a complex question.
Okay. Governor, I know there was some talk earlier this week, I think, about extending an executive order that allows towns and restaurants to do outdoor dining. Are you going to be extending that executive order?
I think we should.
Any idea when that'll occur?
Paul, any idea when that will occur?
That'll happen early next week.
Okay. All right. Thanks, everybody.
Let me just say, first of all, to Jim Rivers, thank you. Thank you for participating. And I got to say, infection rates are going up, but not in Windham. They went down a little bit over the last week. So thanks for taking the lead there, and I hope more people follow your example. I got to say to the people of Connecticut, look, you've been doing the right thing for a long time. We thought we saw a light at the end of the tunnel, and I get it. 6.1% is like a gut punch. And I feel the same thing. And we tried to tell it like it is. I think we know what we've got to do to get through this. We're going to see some progress on a local basis, and I hope we can take that statewide. Obviously, we're a small state in a big region, and a lot of things are going on, but we are going to manage our way through this. And with that, I know we got some holidays coming up. We got a safe Halloween coming, as well as Thanksgiving, and Max has got a small video just to say farewell and hang in there.
This year, the holidays are going to be a little different. But you can still show that you love those you care about by keeping them safe and healthy and staying close to home rather than traveling. Limit sit-down family dinners to household members. Keep any must-have gatherings small and outdoors. Better yet, try a video call or a virtual holiday party. Everyone loves being together during the holidays, but this year, keeping our distance is the best way to make sure we'll be together for years to come.
Be safe, everybody. Thank you.